Plastic surgeon.
Yes.
So we've lots to talk about today. I want to talk about labiaplasties first.
Straight in.
Do you know what? I'm not a big believer in beating around the bush. Is there a lot of blood then, or no?
No, not really. It's all very controlled.
The labiaplasties, are they mainly women that have had kids too, or can they be for younger ladies?
Some, but they're often younger ladies.
Okay. And what do the mums want?
Breast lifts, implants out. I'm taking far more implants out than I'm putting in these days.
Like, I have friends who they would love to get a tummy tuck because after, say, maybe they were very slim, they've had three or four kids, and their tummies are they just aren't what they would like them to be.
And I always say to people that if you have a thing, like it's your tummy, your breasts, whatever it is, that it dawns on you at least once a day that that's troubling you, or you're getting frustrated, or you're at your wardrobe and you're pulling out 5 skirts because none of them are fitting quite right, and your tummy's annoying you. Let's take tummies for the example. Then it's worth doing something about.
I had another friend who did get a tummy tuck, and she was like, "Oh my God, why did I put myself through 10 years of not doing this?" Can I ask you a little bit about misogyny in medicine for someone like yourself?
Yeah. Wild amounts. And you could write a book.
It doesn't seem to bother you.
I think you can look at it now with very different goggles. And derogatory comments in theatre endlessly, stuff that just wouldn't be tolerated now. Did it bother me at the time? Like, it seems terrible to say no, but you kind of just had to suck it up. So the only way to suck it up was to just use it slightly to your advantage.
And smile and laugh at their stupid jokes.
Yeah, exactly. Yeah, and not take offence.
Okay.
You couldn't take offence from some of the stuff.
I can imagine.
Like, what was the answer to that back in the day? You walk out the door in a strop and they just... forget your reference.
Siún, it has been difficult to get you into this hot seat. You're like one of those dermatologist unicorns, but you're not a dermatologist, you're a surgeon, plastic surgeon.
Yes.
So we've lots to talk about today. I want to talk about labiaplasties first.
Straight in.
Do you know what? I'm not a big believer in beating around the bush.
Clearly not.
Absolutely. Actually, put it in context, the bush. So
yes, indeed, or lack thereof now.
Lack thereof.
Which is probably part of the reason I'm doing more.
Okay, tell me about
Very clever.
Tell me about it.
We're a long way from that Sex and the City scene, I think, with Samantha. Her big red bush.
Bozo the bush. Bozo the bush. I know, it's
tell you about it. I am seeing more and more. I think it's probably a little bit of word of mouth. It's not necessarily a thing that I advertise. I learned my lesson on that a number of years ago, where I put a tiny little post up on Instagram about it. And I was trolled.
Why?
Quite viciously for about a month afterwards. Radio stations calling me. People saying that it was genital mutilation, that how dare I propose that everybody should look like Barbie. They didn't get it, clearly.
Yeah, so
and the reason I do labiaplasties is there are a number of things that people say. They don't like the look of their labia. And you hit the nail on the head with the bush, or the lack thereof. Now that we're all waxing, preening, pruning, and getting pretty much rid of all or most of our pubic hair, the internal labia, the 2 inside labia, which is what we're talking about, or the lips, are sometimes really prominent in some people. And I always pick the analogy when people are kind of nervous about doing it or talking about it, or when I'm discussing it with someone like you or friends or whatever. Labias can cause just as many problems as large ptotic or droopy breasts, right? So problems in clothing, catching, disrupting tight clothing. People often find when they're cycling, they have to shift around on the seat because the labia is catching one way, painful intercourse, difficulty with tampons, all sorts of physical functional problems, as well as disliking the look of it. And it's a very simple little procedure to just give it a little tidy up.
And how do you do that?
Under local anaesthetic with my scalpel, my trusty scalpel.
Okay, so it's that simple.
There's no GA? Simple in my office. You can have a GA if you want to, but most of them are done in my office. Just purely under local, no sedation, nothing, just local anaesthetic. Local anaesthetic cream first, so you don't feel any injections. And people say it's easier than a wax. Now, the post-op care is a little bit more difficult than a wax.
I can imagine. Is there a lot of blood then, or no?
No, not really. It's all very controlled. I use a little thing like a coagulation machine, which controls every time I see a little blood vessel bleeding, I zap it with a little coagulation machine. Okay. And I'm that old that I remember surgery before that machine was invented.
Okay.
It a lot more bloody.
Okay.
I think I subjected my poor husband to 2 mole excisions before that was invented.
Would you just go around looking at people going, I could tidy you up?
Not really. I'm often asked that, actually. Do you am I looking at you thinking, not you now, but am I looking thinking I could do that, I could do that? No. Well, I don't see the labias for a start.
Well, yeah, it'd be a bit weird if we were all...
No, I don't. I guess that's my job. Maybe... No, I genuinely don't. If a friend had really droopy eyelids or something, I might say, and they were kind of holding them up at the end or asked me about something, or dinner parties and chatting with girlfriends will often say something about something, and I'll say, well, there's a thing you can do for that.
Okay.
But no, I don't spend my time
wanting
to fix the world.
Yeah, I know. Exactly. If you're a life to live. And I know you're a busy lady and I want to get into all of that. What are the main things that you do in plastic surgery now?
In my practice, I have about 50% is skin cancer. Okay. So I would deal a lot with Katrina and Nikki, all of the Institution of Dermatology, dermatologists as well as a couple of others. They would refer into me, I refer to them. So I cut out the skin cancers and reconstruct the patch of skin that I've left skinless, essentially, by using little flaps, twists, grafts, all sorts of things. That's about 50% of what I do. And then the other 50% is for the most part mums. Obviously the labiaplasties are a slightly younger profile for the most part, for I don't know what reason. But mums I think, because I'm a mum, and I think they come to me because they go on my website and they go, she's got 4 kids, she'll get some of this.
Do the labiaplasties, are they mainly women that have had kids too, or can they be for younger ladies?
Some, but they're often younger ladies.
Okay. I would have thought that the lips get longer after you've had babies.
They get a bit different after you've had babies. I mean, you know this and I know this. Like they get a little bit more discoloured, a little bit more kind of raisiny.
Yeah.
Yeah.
Raisiny, I love that expression.
Deflated, a little bit.
Raisin.
Yeah, and they do get discoloured. I mean, it's like that line that you get down your tummy when you're pregnant. It all kind of gets a little bit darker as you get older. But yeah, I would see certainly a percentage of women who would be my age having labiaplasties, but often they're younger in their 20s.
Okay, that's interesting. I would have automatically assumed they were older.
Yeah, no.
So the other side, so then you get mums, and what do the mums want?
Breast lifts, implants out. I'm taking far more implants out than I'm putting in these days. Now, again, that could be to do with my profile of patient, because I'm seeing mainly mums, not younger women, for breast surgery in particular. And I think a lot of mums get to a stage where they're just like, I don't want the return commitments, of having to have repeated surgery. Because while you've implants, you're going to need another operation. And I think the implants in certain women of a certain age have just kind of done their job, ticked the box. And women are kind of done with it. Implants have also had a bit of a rocky time at the moment with, you probably know this, the ALCLs, the SCCs that have been found in the capsular liquid around implants. And then the textured implants were discontinued and they've had a little bit of a hoo-ha. So,
but if someone has had an implant put in and then they get it taken out, are their boobs not completely disfigured?
No, it depends. I mean, sometimes I have a bit of origami to do afterwards.
Okay.
If they're very big implants in a very slim woman with very little subcutaneous tissue or fat, essentially, then and they'll need a lift. But I generally know, looking at them when they have implants in, and I can show you what your normal tissue is. And I know the women who will respond and retract, by they've kind of got juicy, thick, nice, good skin. They tend to retract quite well.
Love the way surgeons talk about, like that juicy. Thick, nice skin. The way you see people is totally different to everyone else.
Yeah.
I just put up the question box about half an hour ago because we really just booked this last minute.
Yes.
So, and loads of questions are coming in about tummies and tummy tucks.
Yeah.
And even my own, I have friends who they would love to get a tummy tuck because after, say, maybe they were very slim, they've had three or four kids, and their tummies are they just aren't what they would like them to be. They're overhang. They can't wear dresses.
Yeah.
And they feel that they can't go and get this done because they feel that it is
it's such an indulgence.
Yes, and they feel guilty for the fact that they're making themselves go through this because and it's not
society
essential.
Pressure. I guess that they're feeling a bit of that.
Yeah.
And I don't know whether it is a bit of society pressure. I think it's more to do with the lives that we lead now. We're not in our woo-woos anymore, having popped out the kids and in the houses and not really caring what our tummies look like. We are often in hot climates. We're on the beaches. We still wear bikinis. Our clothes now are tighter. They're less forgiving. We like our gear. We like getting dressed up now still. Even though we've had kids and the kids are growing up, we still go out. We still want to look well. And a lot of it's kind of self-pride. And I always say to people that if there are two things that I think with not just tummy tucks, but with aesthetic surgery for mums in particular, I think if you have a thing, like it's your tummy, your breasts, whatever it is, that it dawns on you at least once a day that that's troubling you, or you're getting frustrated, or you're at your wardrobe and you're pulling out 5 skirts because none of them are fitting quite right, and your tummy's annoying you. Let's take tummies for the example. Then it's worth doing something about, provided you do it in a safe environment. Yeah. And the second thing is, like, people don't realize the knock-on effect that you being more positive in your life. Like, I have 4 kids, you have 3 kids. If we're happier, you know yourself, the house does run better. Like, if you're in good form, the house is in good form generally. I know myself, if I'm in bad form, there's a ripple effect through your household. If you've got a thing in your life where you generally feel buzzier and better about yourself, that has a knock on to your partner, to your kids, everything.
Yeah, I think that women have this thing where there's this guilt about wanting to get it done.
Yeah.
And often they'll wait too long. I had another friend who did get a tummy tuck, and she was like, oh my God, why did I put myself through 10 years of not doing this? Yeah. It was absolutely, so I think that we need to kind of get over that hump as
we do. And I think we also have to realize that medicine has come forward in leaps and bounds. I can do tummy tucks now as day case procedure. So you're home in your own bed that night, having had a tummy tuck, no drains, no nothing. You need 3 weeks of recovery. But that's a far wild cry off when I started in plastic surgery training, and they were a much bigger deal. Same with breast reductions. Breast surgery now is all day case in my practice. So you can be back home in Galway, having had your surgery in Dublin on your breasts, and had your breast reduction, and be back home having your dinner in Galway that night. It's mad. And that's to do with anaesthetics, rapid recoveries, better anaesthetics, better surgical techniques, less bleeding, bipolar machine.
Yes. And with breast reductions, that's a much more advanced surgery than breast implants, isn't it?
I guess it depends on, it's longer for sure. I mean, a breast reduction is about 2.5 hours. Breast implant surgery is relatively straightforward. You still have to know what you're doing and know the anatomy, get partially under the muscle. And size things correctly with implants. It's crucial with implants. Gone are the days of giving everyone the same round implants and popping them in under the breast somewhere. Now it's very customized as to what your breast footprint is. So where your breast is attached to your chest wall is known as the footprint of your breast. And if a lot of the implants that we choose now really respect that footprint. So it's kind of a customized surgery as such. Do I prefer breast reduction surgery to implants? Yeah, there's more of an art, I think, probably to breast reduction surgery. There's more things to think about. Okay.
What about the Brazilian bum? Have you done any of them?
No, wouldn't be my gig.
No.
So they're all apparently not their age anymore now, suddenly.
They're taking them out now.
It's quite a dangerous procedure. So fat grafting in your bum is a dangerous procedure. A lot of big blood vessels, you're injecting fat. You can get a thing called a fat embolus, which essentially is like a clot that can go to your brain and kill you.
So it's not actually putting implants into your bum, is it?
It can be. So it can be implants or fat.
Okay.
Yeah.
So what's actually done during a tummy tuck? Because doesn't the belly button have to be realigned and
No, so a lot of things, like, it's a bit like, there are two kind of myths with breast and tummy surgery. Are the nipples taken off and moved? Very occasionally, but in 10 years I've done that maybe twice. Generally they move on the gland. So I'll go back to the tummy. The belly button stays attached to you. All that happens is the breast or the tummy tissue is lifted up off your belly button. So I basically make a cut around your belly button, lift your tummy up. Okay, so your belly button's like a little stalk sticking out through your tummy muscles, and you have a loose sheet of tummy above it with a little hole in it now. And then I pull it all down tight, repair the muscles underneath, and then I have a little look underneath that kind of essentially that sheet of tummy tissue and see the little belly button sticking up, and I decide where it wants to come back through again. So I make a new little port, a new little window for your belly button through the tummy tissue. Okay. So people often find that if they had a mole that was higher up kind of towards their rib cage, the belly button is now beside that mole.
Okay.
Yeah. Does that make sense?
Yeah, absolutely. And there's much more to tummy tucks than just, I suppose, the aesthetic reason as well, isn't there?
For sure.
There's that diastasis that women can get.
And again, most people coming for tummy tucks, I do see quite a lot of weight loss patients who don't necessarily have that gap in their muscles, but mums always have, and I'll always repair it. Even if they've got, half a centimetre, I'll repair it in double layer. So when I have that flap of tissue all the way up, I can see the two strap muscles, the rectus muscles, which are two of a complex kind of core of muscles in your tummy. And I repair them back like an internal corset straight down the midline. But that has a huge benefit on your back long term, on lower back strength, on your core. You go to Pilates and yoga and they're talking about your core strength, build the pillars of your back, keep the front strong to keep the back strong. And I help that by repairing the core muscles back together again. If your rectus muscle is apart, all of the core muscles in your tummy are dysynchronous. So they don't all work together as a core if the two strap muscles are away from each other. So by bringing them back in the midline, the whole thing works better.
Okay.
Also has a knock-on effect on incontinence. So a lot of women will have a little bit of stress incontinence after babies. And if you can imagine, I'm fixing the core muscle, so getting all that back together strong again. Yeah. And I often, as part of a tummy tuck, inherently hitch up the mons a little bit, especially after sections, which can be quite scarred and loose. You've probably seen tummies where you've got like a section pouch and then the mons area seems a little bit kind of poofy and loose, purely because the scar tissue sits there and it all just slides a little bit over time. So when I hitch that up, that has a knock-on effect on the sling basically of your pelvis, which helps with your pelvic floor.
The mons being just the top of the vulva there, isn't it? Where the
where your pubic area is. Yeah.
And so that rectus muscle can part during pregnancy, can't it? And for a number of
9 times out of 10 it does. I remember, I remember the moment mine did. I actually dropped the phone down the toilet in St. James's, my first pregnancy. And I remember reaching back to find the phone, and my tummy did this weird dome thing. And I went, what?
Okay.
But that was like, everyone has a moment where their tummy muscles separate to the point where it's noticeable.
Yes. Okay.
Now, sometimes they come back, sometimes they don't. Sections, I think probably it's trickier to get core muscles or your rectus muscles back in the midline after a section, because if you can imagine, your pregnancy makes them part every time. I mean, you can't house a baby without having the rectus muscle split. It's the whole point. But when you're sectioned, the muscles are apart and you have a scar underneath it. So very quickly you have to get those muscles back together again before the scar knits and heals. Otherwise, you have a band of scar tissue. This is my theory, that the scar tissue sits blocking, making a gap, right? So you have scar here in your section, you have your two muscles here, and they kind of can't get back together again because the bottom is bound by scar tissue.
So what do you do with them?
Tummy tuck.
Okay. So you scoop that scar tissue out?
Yeah. So anytime I have a section, and a lot of my tummy tucks will be cesarean section mums. So I come in underneath the first scar, and often people will have had 4 sections and there'll be 4 scars, and I'll come in underneath the lower one and cut all that scar tissue out.
Wow, you sound like a miracle worker.
Not really. So I often say it's kind of just geometry.
Oh yeah, well that's it actually. And I want to talk about what were you into in school to make you this way? But first
you don't want to know. My poor parents.
I can imagine. I think I suspect you're a little bit like me. Weight loss surgery.
Yeah.
So you don't actually perform the weight loss surgery.
Correct. No, my colleagues do that.
What do you do when?
So once people have lost their, and sometimes it's vastly impressive weight loss, like 9 stone, 11 stone weight loss. And some people take a hard hit. Their body takes a hard hit after that weight loss. Sometimes people are miraculously good. Obviously, I don't see the ones that are miraculously good. But what are the surgeries I do after weight loss surgery? Tummy tucks, breast lifts, arm lifts, thigh lifts.
And do they not leave scarring? Because I've seen
massively so.
They do.
Yeah, hugely.
How do you minimize that?
Scar management. So we would do in like, we have a very simple scar management in my practice that my nurses all do for me afterwards. And basically, if you've surgery with me, you'll wake up with brown tape on your scar. Okay. That stays on for 3 weeks. We see you back, and then we take off that tape, have a look at everything, see how it's healing, replace the tape. And once it's at a really static point, we get you to change your own tape along the scar for 3 months. That's occlusive therapy. So that's not letting oxygen at scars, which is where there is science. There's a lot of stuff on the market.
There is.
Yeah.
And actually I want to talk to you about that, because people always ask me, I have a scar. Will vitamin E oil work?
Massaging works, and occlusive therapy works. There's very little science behind a lot of the other scar therapies. Silicone gels is a little bit on red reduction, applying silicone gel in a very thin layer or a silicone sheet afterwards.
But it kind of needs to be done pretty quickly after the trauma, doesn't it? Because if you're doing it, months or even years afterwards, it's very
the ship is kind of said, like scars, people don't believe me when I say scars are active for 18 months after the insult. So if I touch you with my scalpel, your scar is doing something for 18 months. So if I was to biopsy a scar for every month for 18 months, there'll be some cellular activity going on. And they're quiet eventually at 18 months. That's why we in burns patients, for example, we would keep them in what's called Jobst garments, which are those very tight, kind of almost the neoprene type sleeves and garments like that for 18 months after a burn to minimize that scar tissue and just suppress it a little bit. Massage goes a long way. So once I stop your taping at about 3 months, you can, if there are little kind of knobbly bits of scar left, I'll tell people to massage twice a day.
And even for flat scars, is it good to massage just to get the blood flowing there?
It's more the massaging is more to just cool the jets on the scarring. You're kind of telling your body, your job's done now, we're good. It's closed, it's healed, stop making scar.
Okay.
And thin it down on the bulk of it. Right, and then we've the tricky scars like keloid scars, which I'm demented with at the moment with all the multi-piercings.
Okay.
Yeah, so I have a lot of young girls coming in with big, nasty keloid scars off their ears. Yeah. And there's very little we can do.
Okay.
So actually, if any young person listening wants to develop a cure for keloids, they will never work a day in their lives once they've found it.
Okay. And why? So sorry, why do they happen?
Exactly. We don't know.
But you've loads of piercings yourself.
I know, but they're not through cartilage.
Okay, so it's
now that doesn't mean to say that people can't get them through normal skin, but you're more likely to get it through cartilage.
Okay.
Yeah.
And it's just they're very difficult to get rid of.
Yeah. So and it's the same when I'd pin ears back, for example. I'm making so you can imagine the insult that an earring makes in an ear. If you can have, like I had a girl into me there recently, and her keloid scar was the size of a good old potato.
Wow.
Now, I cut that one off. I don't usually cut them off ever. But she just said to me, she said, like, if it comes back again, I've no option here. It was distorting her ear completely. So all the normal little turns and everything in the side of her ear, all distorted because of this big thing behind her.
Yeah, okay.
So the problem is if you cut them off, they come back bigger. So you just have to manage them with steroid injections and Botox, would you believe?
I do believe Botox.
Amen.
Yes. I believe Botox is the answer.
I believe Botox, full stop. But amazingly, it works fantastically well in keloids.
Yes.
Now, that's my own little experimentational.
With breasts, people that, advocate for breastfeeding, which you and I are both would advocate for breastfeeding. We're both mad into it. I said, "You new breastfeed?" She goes, "Yes, but I've stopped now." Our youngest is like, what, 10?
Yeah. Do you know what? It really worked for me.
Yeah.
It really worked for me. I found it so easy in my world to breastfeed. It was such a convenience for everyone, my husband included, as he used to say to me, just keep it on draft.
Oh God, I was the same.
Highly convenient.
My husband, anytime the babies and then subsequent toddlers, because I fed them till they were all 2, moved or squawked, he'd literally hand them
throw
to me
you, child.
They're starving.
Yes.
He's starving.
Yes.
I think he needs to be fed. It makes it so easy for them.
Yeah, it does. And it's great. And it's great for the kids and it's great for us. And I never had to sterilize a single thing in my life.
I know.
Fantastic.
I know. I was
so I guess given that positive experience that I had with it, I kind of feel that it's my duty to tell people that it is fabulous. And then when I'm doing breast surgery, I would hate to be the reason to take it away from someone. Right? Okay. So there is always a chance when I operate on breasts that I am going to remove that possibility of breastfeeding from them. Now, it's unlikely to completely remove it. If breasts are enormous and the distance from here down to their nipples is, 55 centimeters.
Right.
And there's a long way for the nerves to travel up and the nipple to get back up into place again. It's likely that there's going to be some compromise to their nipple sensation, which obviously has an impact on the breastfeeding. But 9 times out of 10, you can have breast surgery and breastfeed.
So nipple sensation, I would have thought that it was taken away because you were taking out some of the glands.
No, not really. You're taking away some breast tissue, but actually the impulse to breastfeed comes from the sensation through your nipple. Okay. So if I destroy your nipple sensation, you're not going to breastfeed.
Okay.
And there's a chance that with breast surgery that you destroy the nerves.
And they suck away themselves.
They're not going to stimulate anything, so you're not going to get that brain stimulus to make milk. I feel a baby.
I have learned something today.
Every day is a school day.
I did not know that. I assumed that breast surgery interfered with
the volume,
because not necessarily the volume of the breasts. Because I don't have big breasts, and I
same as me. Yeah.
I had enough milk to feed Dublin.
Ditto. So I know stand in the shower and put your 2 hands in it. Please stop.
Or the way you're in the shops and you'd hear another baby cry, and I'd be like, oh my boobs automatically wanted to feed that.
Or being
baby.
Scrubbed in surgery for 6 hours, knowing you really need to get home and breastfeed. And scrubs aren't very kind to breast leaks, even with Johnson & Johnson pads.
I can imagine. You're probably 2 little wet marks all the time. No, I assumed it was because you were cutting out some of the glands. Yeah.
Yeah.
So I know that.
Yeah. So I guess given that experience Yeah, I mean, you are cutting out some of the glands, but generally a lot of the cutting doesn't happen around the nipple deep, right?
Okay.
It's up underneath the breast.
Okay.
Because like I was saying to you, I don't move the nipple. I don't take the nipple off, bar the very odd occasion.
Okay.
Where I'll absolutely need to. If they're just literally on someone's lap, then I'll be saying, look, I ain't going to make this nipple ain't going to make its way back up onto your footprint of your breast.
Yes.
Without losing its blood supply. It'll be too kinked to get it back up there. And then I'll choose to take off the nipple and put it back on like a skin graft. But 9 times out of 10, all I'm doing is moving the nipple up and taking out breast gland around that so that the breast is reshaped. So you cut out a bit of breast gland and then the breast kind of rotates up.
Okay.
And then you close the breast back around it. So the nipple hasn't been moved, it's just moved on the gland.
Okay.
And the breast gland has been closed around.
So what I wanted to ask you about that
totally confusing.
A lot of breastfeeding advocates do not like it when people say breastfeeding causes your boobs to droop. They say, you know, it's more that it's the pregnancy and the change in hormones and all that. So what is the truth?
Yeah, I would agree.
Okay.
Yeah.
So it isn't. So if someone breastfeeds or not, their breasts will still change shape regardless.
Yeah, gravity. It's gravity, not the babies that are killing us. Now, having said that, I did do a bit of pumping with work and stuff. And if you've ever seen your nipple go into a breast pump, that can't be good.
No, I'm the same. So it definitely changed the shape of my nipples.
Definitely. Yeah. But then if you look at a baby sucking on a nipple, if you, people have done all sorts of experiments with ultrasounds and looking at the baby and actually the picture of your nipple on ultrasound and it shoots to the back of their uvula. Yeah. Like it's mad. So yeah, of course, breastfeeding changes or has an impact on your breasts.
But even all the inflating and deflating, that has to have an effect
but like
on your
pregnancy,
skin.
I was a total giveaway pregnant because my boobs got big first. So yeah, it is. It's the up-downness. It's the same with tummies. The up-down is not forgiving.
Yes.
Yeah, yeah. And gravity and time. And people forget the fact that through the having the babies and the breastfeeding and the pregnancies, they're getting older.
And that's it too. So there'll be a lot of ladies that don't even have babies that also might require tummy tucks and booby jobs, etc. Because of just bloody age.
Gravity and age.
And I'd like to get back to that discussion because I touched on it earlier. We are living longer and we're living healthier longer.
Yeah.
And if you took a picture of my granny at my age, she probably had, you know, grey hair, looked a lot older. She probably had her 10th child at that stage, actually, who was probably still, you know, probably still on the boob.
Yeah.
But they looked a lot older.
They did. And the Golden Girls, someone posted a thing. Did you see that thing going around on social media? Yeah. And actually, they were horrifyingly young when they started. Yeah.
Yeah. And
there you go. Same
like
point.
They were grannies.
With the perms.
So we're now living longer and we want to live our best lives.
Yes.
So it's getting back to that point. If a woman wants to go and do something, she shouldn't feel guilty for wanting to do that.
No. We made humans.
Yes.
Like no technology in the world can keep up with that.
Yeah, no, I absolutely agree.
So if you make a human and bring it into the world, do you not deserve to be kind of debabied a little bit if you need to or want to?
If you need to or want to.
If you need to. And some people are perfectly happy not having a tummy tuck and having, you know, the crinkly belly button from when they had their piercings. You know.
Did you?
I did. Do the piercings.
Yes.
Yeah.
I can tell you're a pierced. Where did you get pierced? Just your belly button?
Just my belly button.
You're not admitting to anything else?
No, I didn't have anything else. Wouldn't do it for me anywhere else now, to be honest.
Okay.
Yeah. And noses I have a thing about.
As in
no offense to anyone who has nose rings, but I just, okay. It's the collecting of snot. I couldn't have done ENT surgery for the same reasons. There you go.
Okay.
Yeah.
Do you do nose jobs?
I did. I don't do them anymore.
Okay. So what do you focus on? Mainly the body or do you do the face as well?
I do eyes.
Okay.
Eye lifts. Upper eye lifts now only. I guess I'm in private practice now 10 years and I've kind of really whittled down the stuff that I do. And it means in a nice way that I can kind of say, I do eyes, I do breasts, I do tummies, I do labias, I do a bit of arms, I do a bit of thighs. I do them all well. And if any friends of mine want to have something done, I'm like, I'll do for you. I know I can stand over my product.
Okay.
You know, you don't want me doing a nose job now because I haven't done one in ages. So I wouldn't have a nose job with me.
Okay. Fair enough. Yeah. At least you're honest. So let me get back to young Siún.
Young Siún.
And were you artistic? Because I think it takes a certain amount of artistry to be a surgeon or to want to do things. Were you artistic as a kid?
Yeah.
And mathematical? Is it a combination of both? Tell me.
Probably not unmathematical, if that's a thing.
Okay.
Did I love maths in school? Not massively. But yeah, you need to be able to calculate local anaesthetic. You needed to be mathsy.
Yeah.
Yeah. I mean, pharmacy's a bit of a mind blow of maths. I guess you need to get points as well in your leaving cert, right? Don't you? Like you can't DOS your way through maths and just like biology and art. I didn't do art actually in school, but I would have always painted and doodled and drawn, and I guess a Scrivener said it to me a while ago, Rachel. She said you can see in 3D. All plastic surgeons can see in 3D. And I would have been good at, do you remember back in the day, I don't even do them anymore. We had these assessment things where they'd give you a sheet and it had like, I guess for argument's sake it was origami, but they showed the unfolded version of the house. And it was like, what's that going to look like when it's folded back up again?
You could see that.
Yeah, no problem. Love them.
That's gas. Yeah. Because my sister-in-law's an ophthalmologist over in Australia, and she's obviously lots of fine surgery there.
Yes.
Teeny tiny tools. Oh my goodness.
Teeny tiny tools, like back to my mice days. Yes. Teeny microscopic tools and eyeballs.
She's a really good artist. Like she's really good.
And a lot of my colleagues in plastic surgery would be artists. Yeah, Michael Early was a boss of mine. He's retired now, but phenomenal artist. And quite a few of us would have an interest in doodling. Ona Brint, another guy in Cork, he paints beautifully.
Okay.
Yeah, it's funny. And if I had spare time, like on mat leave now, I would have done big paintings.
Yeah, the woman who literally cannot be pinned down.
But it would be painting. I would definitely. We're doing a house build at the moment at home, and I'm keeping one wall completely blank to make me do something.
Okay, that's interesting.
Just to doodle on.
So what got you into plastics then? What was it? Just that you wanted to do surgery? You loved cutting people
I definitely wanted to do surgery. So to not bore you to tears on it, I was sick. My appendix burst when I was 2. And I was in hospital in Crumlin and had a cardiac arrest, had a bleed post-op, nearly died. And allegedly, since then, I wanted to be a surgeon. And I there was never anything else on my radar, ever. I mean, I drove the career guidance counsellor in Mount Amble mad because she'd be saying, what else are you going to put in your CO form? I was like, what if you do medicine, and medicine.
Okay.
That's all. What about human nutrition or dietetics? I was like, I don't want to do them.
I don't care about food. I just want to cut
I don't want to do them. Yeah.
Okay.
My dad worked in the meat industry. This is horrifying. And my poor parents, I used to get him to bring back things from the meat factories and I'd dissect them on the patio table.
What, as like a young
Hearts.
girl?
Yeah.
Really?
Yeah. Like that's very disturbing as a parent. I can only imagine. They never confessed that it was disturbing, but that could have gone one way or another.
Yes.
Yeah, weird.
So
but I was fascinated as to how it worked. And all the little intricate valves.
Wow, that's
amazing. Yeah. So I thought for a while I might do heart surgery, and then I did urology as an intern, and I loved it. I loved the variation of urology. Not just penises, the girl stuff too. But I just thought it had endoscopic work, it had cancer work, cancer patients, it had big surgery, small surgery, circumcision, skin surgery. It ticked they were all normal.
Yeah, okay.
All the surgeons that I worked with were lovely. And I thought, I could do this. This is good. And I remember one day there was one of the registrars in Tala Hospital with me, and I said, guys, would you all ever leave me and I'll finish off the circumcision? Or no, it wasn't. It was a prostatectomy. So a big open tummy wound, right? I said, you all go for coffee. I'll finish up and I'll tidy up the wound. And he said, he's not going to care what his scar looks like. I said, it's the only bit of the operation he can see.
Okay.
And he went, you need to think about plastics.
Okay.
So I did think about plastics, and then I went to Crumlin for my next job for 6 months, and I was in heaven.
Okay.
Yeah.
What were you doing in Crumlin?
And spotted weirdly the room that I had been in when I was 2 and asked my mum if that was the room, which it was. Plastics, doing burns and pediatric plastic surgery, which I still do quite a bit of as well now.
And what's it like doing burns? Because that's something that's, that's really intricate, isn't it? You're doing grafting from one part of the body to another.
Yeah. Yeah.
So.
I mean, I had a skin graft on a 9-year-old in theatre the other week, 3 weeks ago. My friend's kid caught his foot in the spokes of a bicycle and needed a skin graft. Skin grafts sound horrific, and
they do sound
anytime
awful.
I know, and anytime I say to patients like you're going, it's unusual now to need a skin graft, but often you do them on a head, or if you can't do what's called a flap. So if you can't do a geometry twist into the defect, you might use a skin graft. Like legs, lower shins. There's no pinchy bits on legs that you can twist in, so it's often a graft. And people are horrified the minute you mention it, but they've come a long way. Again, like surgery, they're really uneventful now.
And
now, obviously, burn surgery is a
Okay.
lot different when you've got massive big body burns and you're taking skin from the remaining bits that aren't burnt, and they're intensive, and the patients are really sick. And it's a whole ICU an intensive care kind of component to the looking after of them. I really enjoy burns, actually. I like burns a lot.
So what's your favorite part of the non-aesthetic surgery?
As in, what's my favorite operation to do? Or I guess they're all not dissimilar in that I'm cutting a tumor out, leaving a hole, and then figuring out how to make it look nice again. So there's all this kind of reverse planning that we do. So if you've a, say for argument's sake, a melanoma on your cheek, wear your sunscreen. Katrina's told you that.
Oh my goodness, I know.
So if you've a big hole here, I need to figure out how to make a circle or a square into as close to your normal crease lines as I can. So I want as much of the scar in what's called a Langer's line, a normal crease line of your skin, as I can. So you've got to plan the taking out of the scar, working backwards. So you want to kind of go, I'd like some of the scar to go here. So if I can get most of the scar running down the line here, then I'm going to have to make a little flap this way around and make that 60 degrees and 120 degrees and twist that bit in there.
Okay,
so we're all the time we're trying to,
where you're just cutting it out.
I'd like to think not. and stitching it up. Well, you can't really. So if you can imagine, like I have a big round hole here. If I stitch the edges together, it's all distorted.
Yeah. Okay.
So you've got to get skin from where there's more laxity. So like here, and get that laxity to translate back upwards.
Okay. How the hell do you do that?
Geometry.
Okay.
It's like here, right? You've laxity here.
So
and
just
no
for
laxity here.
all the people that are listening, Siún, I have to verbally picture it for people.
Yeah.
So she's pinching the top of her nose.
Yeah. So here there isn't a lot of give, right? So if I make a hole here, I can't stitch the edges together, right?
At the top of her nose, okay.
Yeah.
The bone on the bone.
Where there's like little enough movement.
Okay.
But here I've movement. I can pinch skin.
Should I pinch in between her eyebrows?
So it's figuring how to get this. Sorry, I keep forgetting that we're talking, not actually being watched.
I know.
And I'm touching my face. So between your eyebrows, you've got a pinchable bit of skin. Mm-hmm. So I need to kind of borrow from Peter to pay Paul, if that makes sense. So I want to get the pinchable bit to translate and move downwards by twisting.
And how do you do that without cutting it?
You have to cut up here. Okay. So that back together again.
Okay.
And then move that bit of skin downwards, like almost like on a hinge.
Okay. Wow.
Clever people have thought of this before me and actually drawn out the diagrams of how to make these rhomboid flaps, etc., and all the degrees and angles that they should be, and we translate them onto faces.
And do you have to use, like, do you literally get out your geometry set?
No, I think
measure,
no.
Can you just tell
I think
by looking at someone?
Once you do them enough, when you start doing these in plastic surgery and you sit down in exams and you have to draw the defects and the angles, and you've got to rehearse, and then eventually you do enough of them surgically that you just draw. Okay. I mean, it's like, I do a lot of 7 centimeters in breast surgery go figure.
Okay.
But now I can draw a line and it's 7 centimeters every time. Okay. Just because it's just repetition.
Just practice.
Repetition. Okay. Yeah.
So when you decided that you wanted to do plastics because the person was going to be stitched up and that was the only part of the operation that they saw, how did you go about doing that? Because we know that the journey of a surgeon is long and difficult. And you've managed to have 4 babies in that time.
Yes.
And be very involved with your kids too.
Yes.
We have a mutual friend who said, this woman is superwoman, ask her how she does it all. So
that's very
was
kind.
it a long and difficult journey?
Yes.
Okay.
Yes.
Would you recommend it?
Yes.
Okay, so that's great. So you love your job then?
Yeah. And it's funny, I think people now are less likely. I often find, like, if I'm talking to girls about wanting to do medicine, say, right, mm-hmm. and they say, we talk to, so-and-so, like my daughter wants to do veterinary. And I remember her doing a work experience and she came back and she said, loads of the interns were saying not to do it and it's really tiring and it's really bad. And that's awful. Like, did I work very hard over the years? Did I have very long hours? Yeah. But I still got my matching toenail varnish on.
Okay.
Do you know, and I think if you're doing what you're loving, if you're enjoying the journey, then hard work isn't a bad thing. But I think progressively in life, I think there seems to be a negativity towards hard work. Mm-hmm. And that concerns me.
Quicker, faster, and now, don't we?
Yeah, and people also want their downtime and they don't want to be in work late and they don't want to be really kind of overkilling themselves. They want to be out experiencing life, which is fantastic. But I think to get really where you want to be in life and to really enjoy your career path, you've had a long career path as well, and you like what you do. Mm-hmm. I think if you don't invest in it and it's not what you want, where you want to be in life, I don't know, there's something wrong there.
Yeah. Yeah, no, I'd agree. In order to enjoy your job, I think you have to invest
You've got to invest in it. And that involves time and hard work.
So
and it's not necessarily negative, I guess, is my point.
Yeah.
Do you know, is doing plastic surgery a long, arduous career path? Damn right. Were there moments that I was not happy? Yeah, you know, driving down to Cork, having had a miscarriage and on call. And like, of course, we've all had our journeys in life through our careers where you're thinking, what in God's name am I doing?
Yeah.
And then the next week brings brighter stuff. And yeah, would I do it all again? Absolutely, in a heartbeat, yeah.
And did you train outside of Ireland as well?
Yeah, so to kind of briefly synopsize what I did, I suppose, I did my intern year in Tala, where I met my hubby in the CT scanner.
What does he do?
He's a radiologist.
Okay.
And then I had
That's a nice job.
It's a nice job. Busier and busier as time goes on.
I can imagine.
Yeah, they're in a lot more. They're intervening a lot more now with kind of stopping bleeding. Instead of patients going to surgery for open surgery, they'll go to radiology where they can kind of zap things and put like glue and coils and cool stuff. It's very techy, yeah. So then I had 2 more years in Tala Hospital doing my basic surgical training. So as an intern, you decide whether you want to go down the medical road or the surgical road. In a nutshell, I went down obviously the very determined surgical road, and we applied to Leinster, Connacht, Galway. We could be rotated all around the country. I got the Dublin one that I wanted, thankfully. So stayed in Tala for 2 years, then went to Crumlin for 6 months, and then to James's for 6 months. And then at that stage in our career path, it's changed a little bit now as to what you need to do. But at that stage, I needed to do lab research.
Okay.
So Run's 4 years ahead of me, and he was at the stage of doing his clinical fellowship, and he was off to Vancouver. And I thought, I'm not letting this man out of my sight. I'll take a job in Starbucks.
Yeah.
So I went to Vancouver, and I got I organised beforehand, but I got a lab research fellowship job over there. Okay. So I did lab research for 2 years.
And what were you lab researching?
Angiogenesis, so neovascularization, basically making new blood cells.
Okay.
And what happens when you tie up one little blood cell and you apply different products, and they had found this sponge off in Dominica that we were testing that could actually promote blood vessel growth in mice.
And did you enjoy that part of your
Did I
work?
Enjoy that part of my work? I missed surgery.
Yeah.
Now I was operating on mice. Obviously it was slightly more microscopic than, I know, again, not an ideal. It's not, don't come after me, all the animal rights people, but it's got to be done for cancer research. Yeah, 100%.
It's just the same with pharmacy, sure.
Yeah.
Everything is tested.
Everything's tested.
First.
Yeah, for sure. Yeah. I missed medicine. I missed the clinical aspect. I missed patients. Yeah. Thankfully I like patients or I wouldn't be doing what I do. Yeah. But I missed it. But we had a super time. We were in Vancouver. We skied every weekend. We had no kids. We, crisscrossed our skis in our 1988 Honda Prelude and skitted up the mountains every Friday evening. So life was good, but we were broke.
Okay.
So I did my research, got my MD, came home, applied while I was away for the a registrar, like the senior registrar training program in plastic surgery. So got that, and then that's a 6-year pathway.
Okay.
So came home, started that, did 6 years, and then swore blind I wouldn't leave the country because I had now had a couple of kids and I was not leaving the country and I was not going to do a fellowship, and I was going to just sit tight and just go on to consultancy without having to go away. And then Ronan said, oh, look, I could take a year off.
That was nice of him.
Yeah, very nice. He's very nice. He said, but I'll pick where we go.
Okay.
So
niceness there.
I think I had been talking about Sweden, and he thought, I am not minding 3 children in Sweden where it's going to be dark at 3. Okay. Yeah, where it's dark 3 o'clock in the afternoon. He said, let's go to Sydney.
Okay.
So
enough.
Off we trekked to Australia with 3 kids.
And what is the difference between doing a fellowship and then just going straight to consultancy?
Most of us do fellowships here. It seems like bizarre. It's kind of, you think, how long is the training? And you have to go on to do further training. Yeah. It's honing down where you want to be. So people who want to do hand surgery will do a hand surgery fellowship. I did aesthetics and operated all the time. So we did, essentially, it's funny actually how you translate 10 years down the line. My fellowship was exactly the practice that I have now. Go figure. Funny.
Okay.
Yeah. But I went over there and I thought, I saw things like, people doing eye lifts in their offices, and I was like, oh.
This is possible.
Yeah, and combining breast and tummy surgery, which heretofore I hadn't seen here. Like, back in the day when we did our exams, if you'd suggested combining breast, eyes and tummy in one go, you'd probably fail your exam. Where now that's what I do every week.
It's standard, isn't it? People just want to go in, get it done. Yeah,
for sure. Now I have a threshold. I know by the look of a tummy, breast, etc. Roughly, I'm thinking in the back of my head how long it's going to take me to do each procedure, because everyone's a little bit different. And I won't have a patient to sleep beyond about 6 hours. There's no massive research. There's stuff out there about safety, but it's intuitive that it's not good for stuff that I could break up.
Yes.
Okay. You know, it's not cancer surgery. That's a different story. If you're spending 12 hours, 14 hours for a cancer excision, this is different. If I'm doing breasts, tummies and eyelids, I could separate them if I thought I was going to be longer than that time zone, I would just take one of them out of it.
Okay.
But it's great to have loads done at the same time.
Yeah, no, I can imagine.
Especially for mums who've kids, right? Because you've got one short, sharp shock of a 3-week recovery. Intense recovery,
and then
another 3 weeks afterwards.
Siún coming in, you know, it's all about the patient.
Yeah, and that I'm big on that. So I'm big on the who is going to mind your children when you are recovering from this. Who is entering slave mode?
Yeah, exactly.
Yeah, because you can carry nothing heavier than a coffee cup if you've had a tummy tuck or breast surgery for 3 weeks. So support's massive.
Of course.
Yeah, or else there's no point. I mean, I think there's a perfect time to do this surgery in your life, and if you can't navigate that properly and you don't have the wherewithal to get that support in, then it's not the right time. And the time will come if it's meant to happen. COVID has brought a lot of accessibility as well. People working from home.
Oh yes.
Yeah, so they can have breast surgery, tummy surgery,
and no one even
back at the desk the next morning. Okay. Yeah, mad.
Just looking a little bit more shapely.
Camera's not working.
Yeah.
If the eyes are done.
Yeah, of course. Yeah.
Yeah.
Of course.
Yeah.
Actually, I remember a lady came into the pharmacy once, and she'd sent her husband away with the kids for a week because she was getting her eyelids done, and she didn't want her kids to see the
horrified.
She says, it's my 40th birthday present to myself, and I don't care.
She's dead right. Yeah, absolutely.
So when you were in Australia, you spent 2 years over there,
did you? Nearly. And brought another baby home.
Did you?
My little Aussie boy, yeah.
You and your babies, you just love
me and my
them.
babies, I know. Thank God time does go on, or I think I would have kept having them.
Well, I wanted, at least 4, but I was told at number 3 that I would be brought to the maternity hospital when I was in labour with the 4th, but I would not be collected because he'd be gone. So I was like,
to another country,
baby, or keep my husband. I think,
no, my husband had the same problem as me. He would have gone on as well. So yeah.
Oh, did he?
Yeah.
Okay,
I had a couple of miscarriages as well. So probably kind of, I remember thinking in Australia, we thought we'll give this another go, and if it ends in a miscarriage, we're done, and we're delighted with our 3. Amazing. And of course I got pregnant.
But
actually, he was a twin. I had a vanishing twin.
Okay.
Yeah. And I remember the Fijian obstetrician over there, Vijay, he was fab, and he said, this was a twin pregnancy. And I remember that moment thinking, I'll never leave Australia.
Okay.
And he said, one's fine.
Okay.
Yeah, so we took home my Aussie baby.
And how did you...
Horrifying, all the people on the plane.
Oh, I can imagine. For 24 hours.
Yeah.
Oh yeah, no, I know. Actually, I went with a 3-week-old to Portugal. My first, like, a mad thing is, do you know this? It's like, I was only 28 when I had him, and I was like, oh sure, I can do this.
It's not going to stop me.
I'm the eldest of 4. I've changed babies and nappies since I was 10. All this, or even actually younger. But I said, I'll bring my baby. My mum and I were horrified, and I'll never forget the lady. So we had a colicky baby, and I sat down in the airplane, and this lady came down to sit beside me, and she was an older lady, like middle-aged, and she goes to me, "Don't mind me, I love babies. If that baby cries the whole flight, that's fine, I'll help you with it." And I just thought, what a way to make a new mum feel okay about the fact that she's got a squawker in front of her.
Yeah, for sure.
Like, it was just
not doing the ding, 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 ding.
I know, or not like huffing beside you. Isn't it amazing how those little small moments that people do in their life can have a massive effect on you? I often think of her, like I wouldn't even know what she looked like when I passed her in the street, but she was just so nice. So it's funny, isn't it?
Yeah, absolutely.
So can I ask you how you navigated surgery, the surgical route, and babies? It must have been, it can't be easy. Because you were a young mum, yeah? Did you?
Yeah, similar to you, 29. Yeah.
So,
and I remember being in the burns unit in James's, on my due date with a foot on my belly, skin grafting some poor sausage.
Yeah. Is it just you just did it?
Yeah, you just did it because I'd never been pregnant before. I'd never been at that stage in plastic surgery training before. So I think you find where you are in your journey. You just end up there, don't you? And you just, and then I had her, and she was a dream, and we thought, this is easy. Let's have another one.
Bang out a few more.
Bang out a few more.
Did you take 6 months maternity leave, or did you take shorter?
No, I did. Yeah, I took 6 months, and then I went back actually after her would I go back after her part-time training? It all gets a bit blurry. I went back after her part-time, and then ended up back full-time again, pregnant again. Yeah. It's a battle, and look, don't get me wrong, there were absolutely weeks and weeks where I was on maternity leave and I thought there's no way I'm going back. And I remember saying to Rona many times, I'm not going back, I don't miss it, I'm fine, I'm totally fine, I'm going to be at home, I'm going to be with my babies, this is great. And I was breastfeeding as well, and had no intention of stopping breastfeeding. And he'd always say to me, just go back, don't make the decision while you're off, go back. And then what happens when you go back? You get back and you love it, but you also just get caught back up in it.
Yeah. I don't think I could have been stay-at-home mother, though. I just don't think it would have filled my cup. But that's an interesting concept, isn't it? What is filling your cup? I just think I need something other than.
Yeah, but we don't know because we've never tried it.
I suppose that's true. But I did have several 3 extended maternity leaves. Well, no, 2 extended maternity leaves. The other, a year. My third was it was only 6 months. We were totally broke, so I had to go back
do what you got to do. Yeah,
but I I just think by the end of it, I needed something else.
I wonder, is that a time though?
I was seeing the dirty floor all the time in the kitchen. Like the kitchen was, I was always.
But if you were home all the time, would it be clean?
The baby and like. No, it wouldn't be. I'm not the best housewife. But I just see the crumbs on the floor, and they always annoy me because there's always crumbs on the floor, no matter how much cleaning you do. Do you know that kind of way? So I just think that when you're out of the house, almost you don't see that.
Yeah.
Home, you don't have time to keep in the place really spick and span. So it was just easier for me, I think, to go back.
Yeah, I don't know. I always have the lure of being at home. I always think, working from home, being at home, just full-time mom. Neither of which I'll probably ever do, which is probably why I kind of lust after them so much.
Okay.
It's like the concept of working from home fills me with such envy.
Imagine if you could have your own little operation room.
And it has happened. There have been many kids stitched on the kitchen table, let's face it.
I can imagine.
But that's different to work. But yeah, I'd like to be at home. It'd be very organised cupboards. Everything labelled. If you move in my house, you get a label on you.
Oh, do you?
Yeah.
Okay.
Yeah. But imagine how much better it would be if I was home all the time.
I know,
but I do love work then, and I guess that's the thing, isn't it? It's like, what is yourself? What is your sense of worth in the world? Like, what do you need in your life to make you feel your best?
Yeah,
is it work? Is it your kids? Is it a combination of the two?
Yeah.
And I think you've got to fiddle around with all this until you find it, and you should fiddle around with it until you find it. And if you're unfulfilled at home or unfulfilled at work, something needs to change.
Yeah, you need to change.
Yeah, but I think there's a balance. I think I probably have the balance now, in that I can dictate my own hours, and I can do school runs, and I can run next door for the rugby matches, and I can manage it myself.
I think I would agree with you there. When I was in the pharmacy and had to be there 9 to 6, not
different.
Leave even to go to the bathroom hardly, because it. That was tough, and
it's
the
a pinch
were
point.
Small, whereas now the last year I am at home more. I can work my own schedule.
Yeah,
so
and you can see things coming up in your life, and you can go, right, well, we need to be away there, or that's an intense week, so I'm going to pull back a little bit. Yeah, you can navigate it a bit better. No, I know what you mean. And I was the same. I was at the same point where I was on call rotas and on Burns call and things like that when the babies were little. And I look back at moments and kind of runs of weeks and days and stuff that were tough and tiring. And, I worked down in Cork for a while, left 2 toddlers in Dublin, and I'd drive down at 5 o'clock on a Monday morning, back on a Wednesday, back down on a Thursday for surgery, back up on a Friday, back down if I was on call the weekend. And I kind of look back at that and I think, how in God's name did we all survive that as a family?
And was that good for you in general? Like, how healthy
I don't know. I had 2 miscarriages that year. I don't know that it was great. Ironically, I really enjoyed my work down there. But it can't be good. It can't be good doing that level. I mean, I remember in the wintertime sticking my face out the window because I was still feeding one of the toddlers. And he didn't sleep at all, ever. I'd be up in the morning trying to sneak out of the house without waking the babies. You remember those days?
Yeah.
And I'd sit in the car, get into my car, and I would stick my head out. I remember distinctly driving through the Curragh on the snowy morning, sticking my head out the window to get a blast of the freezing cold wind so that I'd stay awake.
Tough times.
Yeah, and another day where I was driving down and I was driving my husband's car, actually, I think. Yeah, I was driving my husband's car, and it was snowing, and I was sad. And I was somewhere in the middle of Mitchelstown. Yeah. And I heard a bang in the car. And I wasn't really used to driving his car. And I saw a wheel fly off in front of my car down the road in front of me. And it crisscrossed in front of my car and ran onto the bank, right? And then I heard...
Okay, it was your car.
Yeah, and the car started to swerve and I pulled... Luckily, just it kind of swerved into the bank and I pulled across to the side and I had a complete tire blowout.
Okay.
So I remember sitting in the cold, in the snow, waiting for the AA to come along, and I got down to Cork and my boss down there, I was telling him the story and he's like, do you have there's a tyre in the boot? Give us a look. And I took the boot, I opened the boot in the car park of CUH and the smoke came out of the boot. Oh, he just goes, you should be dead.
But you're not, you're here in
front
of
me. Yes, no. But it's times like that you go, like, they were mad times. Yeah. But I guess the bottom line is I kind of had my eyes on the prize. You get to a point in your career, don't you, where you just go like, oh, I'm kind of close now. Like I'm just going to
determined
do the exam and just bloody finish. Like,
yeah.
And support's huge. I mean, it's a bit like what I was saying to you post-op. Like my parents were fabulous. Mum stopped work when I had that year in Cork so that she could mind the kids. When I wasn't there.
Oh, you need that.
Yeah, you do, and that's like it's your kind of secret weapon, isn't it? When you have your.
I know.
So without that, I would probably have stopped.
In our child minding, and my poor
there you
brother's
go.
over in Australia with 2 little girls, and both of them are doctors, and the two little babies,
and they just don't have that.
They don't have it.
Yeah.
And even like I said to him the other day, I said, "Oh, Mum's coming down to do a bit of laundry to help me out." Like that's what Mum. She
mine too. Mine too. Same. Yeah.
And he goes, "Jesus, I'd love Mum to do that for me."
I know.
Like because it's those simple.
No,
things
I know
to
it is.
Running.
It's tough being that far away. I remember being pregnant in Sydney and thinking, if I go into labour now, early, not that mine were ever early, they were all hauled out. But I thought, if I go into labour, I'd have to phone a friend.
Yeah.
To come in and get into my bed with the toddlers and like what? What? Like if 3 a.m. I have to go into the hospital, I have to go on my own, leave Ronan here. Or if the two of us have to go in if there's an emergency, I'm going to have to phone one of our good friends that we had over there. And you do make family friends in inverted commas. Your kind of friends become your family down there.
Yeah.
But it's a different dynamic.
I can imagine.
Yeah.
Can I ask you a little bit about misogyny in medicine for someone like yourself?
Yeah.
I recently saw an article written by a breast surgeon, Liz O'Riordan, and she said she suffered, awful misogyny throughout her training. The surgeons when she was training would say to her males would say, "Oh, who did you sleep with last night?" Or they'd make comments.
Yeah.
Did you experience this?
Yeah.
Okay.
Yeah. Wild amounts. I could write a book.
It doesn't seem to bother you.
I think you can look at it now with very different goggles. In the world we live in now, where it's all terribly PC and nothing can be said that's out of kilter at all. There can be no comments like that. I'm quite sure that surgical training is a vastly changed landscape from the stuff that used to go on. I remember finding a guy in my bed in the res that just wouldn't happen now.
Okay. He was just waiting for you, was he?
Yeah. And derogatory comments in theatre endlessly, stuff that just wouldn't be tolerated now. Did it bother me at the time? Like, it seems terrible to say no. I think you can use it a little bit. I think back in the day, it was like, I'll give you a laugh and I won't mention who it was. I used to have a boss, and in a hospital that I worked in, I was a junior. Now I wanted to get places in surgery, right? So you want a good reference, you want a good job, you want to do your job really well, whatever it takes. I did anyway. And I used to valet park his car in the morning and carry in all the charts from his boot. Happily. Yeah. And then I'd go up and make his coffee.
And were you his little
pet? Like with my daughter too? No, not his pet at all. That was just part of my job. I just wanted him to think that I was doing a deadly job.
Okay.
Now, as it happened in that job, I was trying to coerce a radiology reg into my life. So I had scan reports very, very snappy.
This is your husband.
Yeah.
You're a minx. You're an absolute minx.
But I think you just I think a lot of us, not that there were a lot of female surgeon trainees anyway. I think that we were definitely a minority then anyway. But you kind of just had to suck it up. So the only way to suck it up was to just use it slightly to your advantage.
And smile and laugh at their stupid jokes.
Yeah, exactly. Yeah, and not take offence.
Okay.
You couldn't take offence from some of the stuff.
I can imagine.
Like, what was the answer to that back in the day? You walk out the door in a strop and they just forget your reference.
Okay. So
and then you didn't get them.
10 people.
Yeah, and then you'd have to go to Donegal and do your surgical training instead of staying in Dublin and getting the jobs that you wanted to get. And you kind of had to jump through hoops a little bit, much more so, I suspect, than now.
Okay.
On a personal level, you know what I mean? Like, I think, But again, there were so few of us as females.
But was it difficult then as a female? Did you have... Yeah, because I know that there's loads of men in women's lives that are absolute champions and cheerleaders. And I would have met so many women that have said, the men in my life have really,
and so many of my bosses would have been utter inspirations to me and amazing surgeons and taught me so much. But
just been a little bit crude sometimes.
Yeah, but that was just that was working life.
Yeah.
20 years ago.
Okay.
That was,
But was it
just
tough
a change
as a woman to get through? Yeah. Like, was it an old boys club?
For sure.
Okay.
Yeah. And even it came up at interview panels. I remember being asked in an interview once by a panel of men how I felt about women, there being a kind of an increasing number of women coming through in plastic surgery, how I felt about that.
And how did you answer that? I
said, well, looking at the panel, I think it's probably a good thing.
Oh, good for you.
Well, there were only men.
Yeah.
In the room. So you definitely felt it. Yeah. And
did you feel guilty saying, oh, I'm pregnant again?
Yeah, I wouldn't say guilty. I would say cringy almost.
Okay.
Yeah. It's like, oh my God, another pregnancy. Siún's pregnant again.
You just can't keep
I know. Whereas in hindsight, like it actually is better to have a junior having their babies in training rather than as a consultant colleague.
Yeah.
Going, see you later. I'm off for another 6-9 months. It's much better. It's sucked up within a glut of registrars where there are lots of people to fill the gap. Rather than when you get to where you get to your kind of resting place as a consultant and then you're the colleague that's a pain going off and leave a million times.
Yes.
I think.
No, well,
but I definitely felt it. Yeah, no, for sure. Then there were comments and there was stuff. Yeah, no, I mean there were arguments and tough times and
did you ever feel you didn't get a job or a position or something wasn't because you were female?
No, I don't think so.
Okay.
No, I don't think so. Isn't that interesting?
Mm-hmm.
Yeah. So did it obstruct me in any way going through? No, but I think that's probably because of the tenacity I had to get where I wanted to get. And that sounds very like I was, all guns blazing, but I just wanted to be a surgeon.
Well, there's nothing wrong with that.
But I wouldn't say like at any point that I was difficult about it.
Yeah. Okay.
I just stood my ground.
And what is your standout moment as a surgeon? Do you have any?
As in?
What's your, if you can think of a time in your career or your life that was, apart from having your children.
Yeah.
What was the best, or can you think of something that a really standout moment? I don't know, an interaction with a patient or a surgery that you did and you didn't really know that you were able to do it. Your first, the first time you cut into someone.
Oh, I think there was a guy I looked after in one of the hospitals as a senior reg, and I was due to go to Australia. I stayed on to look after him, and I operated on him about 35 times. He had that flesh-eating bacteria, and lost. He had a daughter my daughter's age, and he was dying in intensive care the night that I incidentally came across him. I happened to walk through the intensive care unit, and talk to one of the nurses that I knew there, and she told me about this case that I hadn't heard about, which normally would come to plastics. And I said, "Do you want me to have a quick look?" And I took him to theatre that night, and saved his life, I guess. And it's not that common in plastics to save a life per se. So I guess you do remember those times. You remember tough cases as well, things that didn't go well. Like I remember kids with bad burns dying. You remember a few of them very, very vividly. But then I guess, I came to be a surgeon because a guy saved me.
Yeah, okay.
And I met him when I was a medical student, and I was talking to his registrar back in Harcourt Street. We were doing an appendix one night, and I was scrubbed with the registrar, and I was telling this Italian registrar, Salvatore was his name, I think, years ago, and I was telling him the story about Prem Puri and how he literally had found me on the ward, clapped out bleeding when I was 2, post-op, and carried me in his arms upstairs to theatre, and got the anaesthetist out of the smoking rouse into theatre, opened my tummy and saved my life, like single-handedly. And I was telling it, and he was telling his registrar, and he's like, "This is an amazing story. Wait till I tell Mr. Puri." And a couple of days later, Prem Puri was giving me a tutorial in Crumlin, and I waited back afterwards, and I stood after all my other students had left, or my class, and he stood up and he had tears in his eyes, and he just said, I can't believe you're doing medicine. I can't believe it's you. My wife remembers this happening.
Wow. Yeah. Isn't that amazing?
Yeah. So like he had a knock on to influencing me. So it's only right that I would have a knock on in somebody else's world as well, you know? And I think medics in general, like, there's a want in us to help and to fix, right? Or we wouldn't be doing what we do.
Yeah.
And there's a satisfaction that comes with that. And that's my point about jobs and careers now for young kids like my daughter's age. And I see them going out into the world, and I'm like, do what you want to do. Don't listen to the naysayers, follow it.
Yeah, no, I would agree with that too.
Would you? Yeah.
Oh, 100%.
Yeah.
Do any of your kids want to follow you into medicine?
One definitely doesn't. Like I was having a chat with him one day, and he said he heard me on a meeting. He's 12, same as yours. Yeah. And he said, I think I was on one of the MAC meetings at work, and we were discussing getting rid of masks. And he said to me in the car after I hung up, he said, are you still wearing masks at work? And I said, well, I wear them in surgery, but like the whole discussion was that we're getting rid of them in the hospital, which is great news because like we can actually see each other's faces now, etc. And he said, but you're still wearing them in operations? And I said, yeah, but I always have and I always will. And he said, well, why do you wear them in operations? And I said, well, in case I sneeze on a patient, but also in case things splash in my face. And he's like what? I said, well, like fat or blood. He's like, what in your face? Like, it's like, yeah, he's not going to be my surgeon. I wouldn't be surprised if one of the other two boys did.
Okay.
My daughter is animal bananas, horse bananas, and that's her thing. She's funny. She came into surgery with me. Hope she doesn't listen to this. And I had her scrubbed up in surgery, and some people are kind of fainty. You get students coming in all the time in TY and stuff. And some of them are kind of don't want to really be part of it, think it's a bit weird, think it's a bit icky, but are happy to kind of vaguely be interested from a distance.
Okay.
And she literally was up beside me going, pass me the scalpel.
Okay.
So that was very much me.
Yeah, okay.
Clearly on the patio table with the eyeballs.
That's nuts. Like, that'd be the opposite now. I would not have
liked
it's funny.
But I guess you just, like, I've never been remotely squeamish, but always just there's been an insatiable curiosity about stuff and how things work and making it better and fixing it. And I think that's, as a surgeon, I love that. I love that I can see someone and go, particularly for the cancer stuff, it's like, cancer in your face, I can cut it out, I can patch it back. Job done.
Okay.
That's very rewarding.
It must be liposuction. Do you do that? So is that part of the way, under what circumstances do you do that?
I generally only would do that as a kind of adjunctive procedure. So like I always have a liposuction cannula beside me for tummy tucks, say, often with breasts as well, just to do a little bit of contouring as part of it. As an independent thing, would I do liposuction on a tummy just for liposuction as a single procedure? No. Wouldn't inspire me overly to do it either. And again, I want to do stuff that I like doing so that I can give patients, I feel like I'm giving them a good job. Like I love doing tummy tucks. I love doing breast lifts. I love taking out implants, doing a breast lift, taking fat from the tummy, putting it into the breasts and shaping it back nicely again. Like, and
can that, if you take fat out of the belly and you stick it into the boobs, can you get a really natural looking boob? And does that fat dissipate at all though, or does it stay there?
You lose a bit. And those techniques came out a good few years ago, and we would originally say kind of you'd hang on to about 50%. Then techniques got a little bit better. We said hang on to 55%, and they get better and better all the time. So basically, the less time the fat is out of the body, the better. The less you do to it, the better. So the purer it is. So if you suck out the fat in what we call parcels of fat, so where it's not mulched at all, for want of a better word, so it doesn't get squished. Like you can see it coming out in globules, and you get that back in as fast as you can without disrupting the parcels of fat. Like if you look at fat itself, you can pinch the fat cells and they'll basically dissolve. Like melt.
Okay.
But they do have a very thin little layer around each little blob of fat. So delicate. So that's a parcel. And if you can get as many of them back intact, you'll retain that much better than if it was mulched.
Okay.
Mushed.
I want to look at my question box on Instagram quickly to see if I have anything that I've left out, because inevitably I'll miss something. People were very interested. The eye surgery that you were talking about, what does that involve? Is that sounds to me now like anything to do with eyes I'm really squeamish about anyway. So
am I, if that reassures you.
Oh, are you? But cutting into someone's eyelid and then like,
but it's only just a little skin above your eyes. So I don't do, I would do them in my office a lot, just under local anesthetic. So no sedation or anything, just numbing cream again. Like you'll never need one.
Really?
Truly.
You're picking your eyelid.
I know, but I'm just to point out that's just a little bit of skin. And a lot of people have a lot of bit of skin there. So you just cut out design little ellipse and cut the skin out, take a tiny little strip of the muscle, sew back up, and it's about 25 minutes.
Wow.
And it's a lovely little refreshing procedure.
And it's under local anesthetic.
Again, you can have it under sedation or general anesthetic if that's your, if when I say to people, you can have this under local anesthetic and they marginally vomit at me, then I know they're one for sedation or general anesthetic.
Okay. Yeah.
Or they look alarmedly at me.
Yeah, okay.
Under in the office here. And I'm like, we'll give you some sedation.
And then facelifts you don't do?
I don't, no.
Okay.
No. I leave them to my pal Richie.
Yeah. Leave it to the person that loves doing it.
Correct.
Right?
And is doing loads of it. Like we're a small country here as well, you've got to bear in mind. So a small country, that then small volume of people wanting plastic surgery, though it's increasing. But if you compare us to the likes of England, we've a very small population. So for all of the, whatever we are, 46 plastic surgeons in Ireland, if we're all doing a little bit of everything, no one's extremely good at one thing. Whereas I think it's quite nice to hone in on a couple of things that you can confidently say, I'm really good at this now.
Do you do breast reconstructions post mastectomies?
No.
Okay.
There's a lot to them. There's a lot of, and you really need to be part of kind of a big MDT, a big process. I don't work in a hospital where we have primary breast surgery, oncological breast surgery. I would do a lot of, down the line stuff on post mastectomy. So exchanging implants, doing a bit of fat grafting, nipples, symmetrizing the other breast, things like that aren't in the acute phase. But generally the breast reconstructions are done in a centre that has the breast oncologists with them as well. Because
actually questions come in here saying I've had a double mastectomy. How long should I wait for reconstruction?
Depends on what treatment you've had, whether you've had radiotherapy, chemotherapy, etc. Radiotherapy in particular damages skin and there's a time. It depends on what has been done.
Damage implants as well.
Yeah. It damages the skin. So it's just it makes surgery kind of precarious to do reconstruction, which is where autologous tissue or using your own tissue comes into play. So using your tummy as a breast reconstruction tool. Instead of having an implant where you have radiotherapy, if you take your tummy and its blood vessel and plumb it into the chest, you can use that to make a breast.
Don't they do an awful lot of mastectomies and reconstructions in the one go if they possibly can, because the skin will tighten if they don't?
Yeah, again, it depends on the tumour types and it depends. There's a lot of play. There's a lot of factors that will decide or dictate your kind of pathway on reconstruction on the timing front. Okay.
Look, I could talk to you for hours, but I know we both need to go. I have a date tonight.
Oh, hello.
I'm going out for pizza and wine.
Nice.
But is there anything else that you'd like someone to know about it? Look, if you were talking to medical students now, particularly females actually, that are thinking of choosing the surgical route, would you have any words of advice for them?
I think there's a lot of people who'll tell them to not do it, sadly. And I think, again, that's terrible. I certainly wouldn't. And anyone I speak to on the kind of career advice, I think it's tough, it's long. But if you want to do it, it's like an itch that won't go away. You can't scratch it away. You've got to do it. And like you, if you get to where you are and you enjoy your job, it's been worth the journey.
Okay. Fair enough. Okay, I'm going to ask you the last two questions that I ask every guest. I hope you read that long text I sent you with the directions to the studio, because some people just see the directions, they forget what I've written.
Take the code.
And then they look at me like a bat out of hell. And they look at me like deer in the headlights when I say, I have two questions for you. Anyway, they're easy questions. They're not a mathematical equation. Anyway.
Thank God.
What advice would you give young people today?
I think I just alluded to it there. Don't listen to, I think there's a lot of negativity on don't be stressed, don't work too hard, don't take a job that's really difficult. Do, if it's what you want to do. Don't be scared of getting stuck in and putting in the hard yards, because it might be the best time you ever spent.
Lovely. And then what is the meaning of life?
I think if we knew, we probably wouldn't be bothering doing any of this, perhaps. So it's probably best we don't know. No?
Fair enough.
Maybe that's the
answer
big,
we've had on the pod.
Well, maybe that's the big secret.
Maybe it is.
Yeah.
Maybe there's no meaning and we're just all here.
Or maybe there is a meaning, and if we knew the meaning, we really wouldn't bother with careers.
Fair enough. Siún Murphy, you have been an absolute pleasure.
Back at you.
Thanks so much for joining me.
Thank you, Laura.